Our first item on our agenda today is House File 3539. Welcome back to the committee, Representative Edelson. I will move House File 3539 be re-referred to the Public Safety, Finance, and Policy Committee. Representative Edelson, to your bill.
Thank you, Mr. Chair and members. House File 3539 takes steps to make compressed aerosol dusters like this one right here more difficult to obtain in retail stores in Minnesota. What appears to be a harmless product has in recent years become the cause of many deaths, harm, and addiction to Minnesotans. This is due to the toxic nature of ingesting a chemical called DFE. It's a liquefied gas. People ingest these products to get high by spraying them in their mouth or in their nose. DFE causes intoxication or death. This is not only an increasing problem in Minnesota, but it's across the United States. I sent members a copy of the U.S. Consumer Product Safety Commission's report on aerosol dusters. It should be in your packet or a link to it. This is not only, in this report you will also find the data from NEAS, which is the National Electronic Injury Surveillance System. In the timeline between 2006 and 2020, the review numbers showed that 70% of the incident victims were male. There were 1,126 deaths that resulted from this. The youngest death was a child that was 13 years old, and the oldest was a 70-year-old man. 37 deaths were in Minnesota. The highest usage was between the ages of 18 to 54, and there were 25,300 ER visits due to injuries. This is not a small occurrence. According to the data published in the 2019 SAMHSA, the Substance Abuse and Mental Health Service Administration estimated that 2.9 million lifetime uses of these computer cleaners or air dusters is occurring now. The bill before you seeks to start to regulate this product that is being abused due to the chemical, again, called DFE. And so what the bill before you does is it mandates that these items right here be placed behind the counter or in a locked case in retail facilities. It requires that you are only able to sell 3 per day. It requires that all said products are sold that have it will be half of the can would be covered with a warning. And I have worked with physicians and Hennepin Health to work on what that language would look like. And we have a testifier here today. So with that, Mr. Chair, I'd like to, we have some impacted families, one who has lost their son, Tommy, another family who their child is actively struggling with addiction with these products. And so I ask members to be very respectful, as always, as you are. But this has been a really hard time for families in the state of Minnesota. And I'd love to call our testifiers, please.
Thank you, Representative Edelson. The first testifier we have on the list is Samantha Lee, the Director of the Hennepin County Poison Control. You just come forward, state your name for the record, proceed to your testimony. Welcome to the committee.
Hi, Mr. Chair and committee members. My name is Samantha Lee. I'm the Director of the Minnesota Poison Control System, and I'm a pharmacist and a clinical toxicologist. For the past 5 years, our Poison Center has managed close to 100 cases related to air duster exposure in Minnesota. However, I must stress that this number is likely underestimation, since calling the Poison Center is voluntary. Most of these cases involve individuals in their 20s and 30s, highlighting the vulnerability of a demographic often unaware of the lethal risks associated with inhalant abuse. A 2023 published study by our Poison Center colleagues in Ohio reviewed the National Inhalant Misuse Report to the National Poison Data System from 2001 to 2021. It revealed that U.S. Poison Centers managed over 26,000 inhalant misuses over the 2 decades, with just over half of these composing of Freon and other propellants, including DFE containing air dusters. 41% were associated with a serious medical outcome, and over a quarter were admitted to healthcare facilities. DFE containing air dusters are widely available at low cost and usually not considered a poison or dangerous by the public. But inhalant abuse creates an immediate high that can last for minutes to a couple of hours, and the chemicals within the air dusters can take the place of oxygen in the blood and the brain, leading to effects such as drunk and dazed appearance, unsteady gait, or loss of consciousness. The biggest concern is that it can cause sudden sniffing death syndrome and produce irregular heart rhythms that may lead to cardiac arrest and death. The provisions outlined in this bill are essential safeguards against further harm through sale restrictions and prominent health warnings. I commend the efforts of this committee to prioritize public safety and address the urgent need for legislative action in combating inhalant misuse. Thank you for your time and attention to this critical issue.
Thank you. Our next testifier is Katie O'Mara. You want to come forward, state your name for the record, proceed to your testimony. Welcome to the committee.
Welcome. Thank you, Mr. Chair. Ready?
And take your time.
My name is Katie O'Mara. I'm the mom of Tommy Byers, my only child. On November 1st, 2022, Tommy's life was stolen by difluoroethane, the poison in computer duster. Representative Edelson has been helping me through this, searching for how we can stop our loved ones from dying. My child did die. It could be your child or anyone's child that's the next victim. Our expectation today is that we find a way to protect our kids from dying from this poison. Tommy's dad and I had no idea what this huffing was. We'd never heard of it. We didn't know the signs. We didn't even know it existed. No one deserves to die like this. No parent deserves to lose a beloved child to a cheap hardware store can of poison. In a span of 3 weeks, Tommy's free will was gone. He was no longer making decisions for himself. The psychoactive properties of the poison had taken over. How can we stop this from becoming a giant epidemic, from infiltrating our schools? For starters, let's shine a great big light on this stuff. Let's be brave and talk about it. No more hiding, no more lying, no more shame, no more fear. My son was an accomplished professional man, charismatic and deeply committed to his large group of colleagues and dear, dear friends and family. I can't save Tommy now, but I can help save other people's children. We must pass this law. Tommy's word was Tommy's truth. When Tommy loved you, he loved you forever. I know my son is here with us now. I love you, baby.
Thank you very much for sharing your story. I know it was very difficult.
Yeah, thank you for having me.
Thank you. Our next testifier is Colonel Matt Langer from the State Patrol. Colonel Langer.
Good afternoon, Mr. Chair, members of the committee. So there is a traffic safety component to this bill, that being if we can keep dust off and similar products outside the hands of people using it inappropriately, there is an opportunity to save lives on the highway. That's not as common as other drugs or substances that people can abuse, but this is one that people do abuse, and I can remember at least one fatal crash that killed a father and young son that was dust off related years ago. So if we can keep this out of the hands of people using it for inappropriate purposes and safeguard that, I think it's a good thing for our state, including traffic safety.
Thank you, Colonel Langer. We'll now move to members of the public to testify. We did have one member of the public sign up in advance, Bruce Newstead from the retailers. Mr. Newstead.
Mr. Chair, good afternoon. Members of the committee, I'm Bruce Newstead with the Minnesota Retailers Association. I work with retailers across the state. Some of them are your smallest Main Street brands up to your more large national known brands. I appreciate the opportunity to talk today about Representative Ellson's bill today. We've had a great conversation with Representative Ellison. I think you've heard some of the problems associated with the product. We continue to talk to Representative Ellison about what behind the counter might look like and looking at what an effective date might look like to make sure there's a reasonable opportunity for folks to get this right from a retail perspective. Should the legislature decide that this is an issue, we'll certainly work hard to make sure that age 21 provision is in place. So we look forward to continuing to work with Representative Ellison on this issue. Thank you, Mr. Chair.
Thank you, Mr. Newstead. Are there any other members of the public wishing to testify as to this bill? Seeing none, we'll move to member discussion and questions. Discussion to the bill. Representative New Brindley.
Thank you, Mr. Chair and Representative Edelson. I just have a couple of quick questions. One, I'm wondering, it says specifically, it makes sense that this would be behind the counter, offer additional protection that way. The provision that would not allow a retailer from selling more than 3 cans in a single transaction, and I apologize, I didn't get all the way to the end of the bill. Are there any exemptions? I mean, I'm thinking of situations where there could be, well, I guess maybe it doesn't apply to distributors. Like, how does this apply? I'm just thinking of somebody who runs a computer repair shop who maybe has a retailer that they use to purchase these products. Like, how would it affect things like that?
Representative Edelson.
Thank you, Mr. Chair. Thank you, Representative, for the question. You'll see that we're only regulating essentially retail storefronts for the most part, and we're not going to be doing that in bulk because a lot of corporations are using that, but that's not where we're seeing the problem. Some stores where they're actually seeing this happen often is they've already put it behind the counter. People are using these products literally within the store. So we're limiting it to 3 because there is oftentimes, if you look at some of the data, if you look at the report that you have within, sometimes you'll see 12 cans in someone's car when they passed, or up to 40 bottles in their apartment. We're trying to get at the issue. So what we know about retail or other regulation of products that are causing public harm and a public health issue is that putting them behind or limiting sales actually does improve the situation to some extent, but the computer supplier would be able to get theirs probably in bulk. They're probably not going to buy it at a retailer. So I guess in that instance, where the public health situation would be that they would buy it via mass online through their manufacturer or right through the distributor.
And I do note you have an exemption on lines 2.4 and 2.5 for exactly those transactions you were just talking about. Representative New Brindley?
Thank you, Mr. Chair. Okay, I was thinking specifically of a small mom and pop computer repair shop who this could be problematic for, who wouldn't be purchasing massive, bulk quantities from a distributor online. I'm just thinking of those. My other question is, where did you come up with the specific labeling language? There is a lot going on here with the labeling. Where did you come up with these specific labeling requirements? This is pretty unique, I think, and unusual from what I've seen in the past.
Representative Edelson.
Mr. Chair, Representative, I think if a small computer person needed to have, it was a small shop, I don't know that they're going to need more than 3 cans of this right here in one day. So I guess what I would say is I would consult it with Hennepin Health and a group of physicians on the language on the bottle. It is actually, a lot of it is contained within the consumer report that I provided. But I don't know if we could call up the testifier from Hennepin Health. Again, the pharmacist could probably speak to where the language came from. I believe it was from several other states.
Ms. Lee, are you able to step forward and provide a little more information?
Mr. Chair, Representative, the labeling design, we reached out to several of our colleagues in the Poison Center world to kind of give their ideas on what sort of things would be helpful to the public. A lot of it is trying to make it more visual and easy for users when they're glancing at the bottle to see versus having tiny writings that you really have to read through it to recognize the danger that's behind the product if it's being misused.
Representative Brindley?
Thank you, Mr. Chair.
Representative Liebling?
So, thank you, Mr. Chair. And first of all, I just really wanted to thank you, Representative Edelson, and your testifier for this bill. I did not know about this stuff. So right now, they have done something really important, and you have, just by bringing this to the public. So I just wanted to really start there. And this is just really horrifying that this is happening. And it seems like it sure ought to be preventable in many cases. So just even from the point of view of knowledge, which is what the labeling is about, of course. I just really wanted to ask if, and maybe you don't have this information right here, but this seems like something that, first of all, is there some other product that could be, some other propellant that could be used that's less harmful? And is there any movement at the federal level to actually ban this stuff? Or this just seems like it's such a huge issue, and it just seems like it ought to be fixable.
Representative Edelson?
Thank you, Mr. Chair, and thank you, Madam Chair, for your question. These products are about $10 per bottle. There are other ways to clean that could provide chemicals in it, the DFE. So there are other options. There are also electronic options where you could just use a powered electronic where you can recharge it, and there's no chemical at all. So really, I mean, I really tried to take a pragmatic approach on this bill, that we wouldn't ban it because there is work being done at the federal level right now trying to address this issue. And I told you, there was thousands, more than 23,000 families that we know of that have been impacted by this, and they're really advocating on the federal level on this issue.
Representative Dotson.
Thank you, Chair. Number one, I have to say it's very unfortunate to hear about your family members. It's tragic. I'm so sorry to hear that. But more of a question than anything else is, educate me a little bit. Is this similar to what they call huffing, where it's actually aerosol cans where you see I've been at grocery stores where you see Cool Whip, and there's cans of Cool Whip. Is it a different product or is there something different? And second part of that question would be, how do we manage this as far as age appropriation, as far as marketing and selling these products? Because that's a whole other issue when these products come out for marketing and selling at the store as well.
Representative Edelson.
Thank you, Mr. Chair. That's a really good question, Representative. We made the bill we're putting it either behind the counter or behind a locked case, and that you have to be 21 or older to purchase it. So we're trying to limit access to these products. We limited it to 3. With that, it's not the same as Cool Whip, right? It has Cool Whip doesn't have that DFE, that chemical compound in there that is automatically getting people high, and also not only getting them high, but it results in oftentimes death. And so it is not, so I'm passing around a can just so you have it. People are adding bitterants to it. That's been a national discussion, if bitterant is a way to make people stop. But there's a lot of arguments that show that actually doesn't. People just get used to the bitterant. And so not actually as helpful as one would have thought. So I think there's a lot of discussions nationally. I think this is a good beginning bill to start the process of trying to make public awareness on this and protecting people.
Thank you. Thank you, Representative Edelson. Any closing comments?
I just thank committee members for your time today. I also included the poison control data right here. It's 94 count in the last 5 years that have impacted, but I would just say these numbers are low for Minnesota. Not everybody's calling poison control. Not everybody is gathering that data. We don't have it. And if you look, the numbers keep increasing. So I ask members for your support. Thank you.
All right. And with that, I will renew my motion that House File 3539 be re-referred to the Public Safety, Finance, and Policy Committee. All those in favor say aye. Aye. Opposed?
No.
Motion prevails, and House File 3539 is recommended to be re-referred to the Public Safety, Policy, and Finance Committee. Thank you, Representative Ellison. Thank you for coming here today and sharing your story again.